Have you ever climbed one flight of stairs, carried groceries from the car, or walked across a parking lot and thought, why am I more winded than I used to be? If you're over 50, that moment can feel frustrating, even a little unsettling. Today, let's talk about shortness of breath with everyday activity, what it can mean, what may contribute to it, what gentle lifestyle steps may help, and when it's important to call a healthcare professional. I'm William from VitaBloom Wellness, and before we go further, here's the most important point. Feeling winded is not a diagnosis. It's a body signal. Sometimes it's related to simple things, like being less active for a season, poor sleep, stress, or rushing around. Other times, especially when it's new, worsening, or paired with warning signs, it deserves medical attention. Let's start with what shortness of breath can feel like. Some people describe it as not being able to get a full breath. Others feel tight in the chest, need to stop halfway up the stairs, or notice they can't talk while walking the way they used to. For many adults, the change is gradual. You may not notice it until a familiar activity suddenly feels harder. One common non-diagnostic reason is deconditioning. That simply means the heart, lungs, and muscles are not as used to activity as they once were. This can happen after an illness, a surgery, a stressful caregiving period, a long winter indoors, or months of sitting more than usual. The body adapts to what we do every day. If daily movement drops, stamina can drop too. Another possible factor is muscle loss with aging. After 50, many people gradually lose strength unless they actively work to maintain it. When the legs and core are weaker, climbing stairs takes more effort. That extra effort can make breathing feel heavier, even if the lungs themselves are not the main issue. Breathing can also feel harder when you're carrying extra weight, rushing, dehydrated, or eating a very heavy meal right before activity. Hot weather, poor air quality, allergies, or a recent respiratory infection can make a normal walk feel harder than usual. Stress and anxiety can also change breathing patterns. That does not mean it's all in your head. It means the nervous system and breathing are connected. But we also need to be honest. Shortness of breath can sometimes be related to heart, lung, blood, or circulation concerns. It can also be connected with anemia, certain infections, or medication side effects. That's why the pattern matters. Is it new? Is it getting worse? Does it happen at rest? Does it come with chest pressure, dizziness, fainting, a racing heartbeat, or swelling? These details help a clinician decide what needs to be checked. Here is a simple takeaway you can use today. Compare your breathing to your own normal, not to someone else's. Ask yourself, could I do this same activity a month or two ago without stopping? If the answer is yes, and now you cannot, that's worth paying attention to. Now let's talk about gentle lifestyle support, starting with food. Food will not magically fix shortness of breath, and it should never replace medical care. But steady nutrition can support energy, muscles, and overall cardiovascular wellness. Aim for balanced meals with protein, colorful plants, and slow-digesting carbohydrates. For example, breakfast could be Greek yogurt with berries and walnuts, or eggs with whole grain toast and fruit. Lunch might be a turkey and avocado wrap with a side salad, or lentil soup with vegetables. Dinner could be salmon, beans, chicken, or tofu with roasted vegetables and brown rice or sweet potato. Iron-rich foods may matter for some people, because low iron can affect energy and stamina. But don't start iron supplements unless your healthcare professional recommends it. Food choices like beans, lentils, lean meats, spinach, eggs, and fortified cereals can be part of a balanced diet. Pairing plant-based iron foods with vitamin C foods like citrus, strawberries, bell peppers, or tomatoes can be a simple meal habit. Hydration also matters. Even mild dehydration can make you feel more fatigued during activity. Keep water nearby during the day, especially if you spend time outside, drink a lot of coffee, or take medications that affect fluid balance. If your doctor has you on fluid limits for a medical condition, follow their guidance. Now, movement. If your shortness of breath is sudden, severe, or unexplained, don't try to push through it. Get medical guidance first. But if your clinician has said gentle activity is appropriate, rebuild slowly. Think of it as training your body with kindness, not punishment. One easy approach is the walk and talk check. Walk at a pace where you can still speak in short sentences. If you can't speak at all, slow down or rest. Start with 5 to 10 minutes on level ground, a few days a week, if that feels safe for you. Over time, you may add a minute or two. Consistency matters more than intensity. Stairs can be a useful gauge, but they can also be demanding. Use the handrail. Step slowly. Exhale as you step up. Pause on the landing if needed. There is no prize for rushing. If stairs suddenly become much harder than usual, especially with chest discomfort or lightheadedness, that's a reason to check in with a healthcare professional. Strength work can help too. Simple sit-to-stands from a sturdy chair, wall push-ups, and gentle calf raises can support the muscles that make walking and stairs easier. Keep it controlled. Breathe normally. Don't hold your breath. If you feel chest pain, faint, unusually dizzy, or severely short of breath, stop and seek help. A daily habit that many people overlook is posture. When we sit hunched over, the chest and belly have less room to expand comfortably. Try sitting tall, relaxing your shoulders, and taking a few slow breaths with a longer exhale. This is not a treatment for a medical problem, but it can help you notice tension and slow down. Let's make this practical. For the next week, keep a simple breathing note on your phone or a notepad. Write down the activity, how breathless you felt from 1 to 10, and whether anything came with it, like chest pressure, wheezing, cough, dizziness, swelling, or unusual fatigue. This kind of note can be very helpful if you talk with your clinician. Now, when should you seek medical help? Call emergency services right away if shortness of breath is sudden or severe, happens at rest, comes with chest pain or pressure, fainting, confusion, blue lips, coughing blood, or a feeling that something is very wrong.